CEN Test Prep Exam free. Question 1. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 2. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. Question 3. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as: Option A, TSI level 1. Option B, TSI level 2. Option C, TSI level 3. Option D, TSI level 4. The correct answer is option A, ESI level 1. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. Question 5. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes: Option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. Question 6. The safe harbor provision for nurses typically refers to: Option A, a law that provides legal immunity in all circumstances. Option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option B, a process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Question 7. Pulsus paradoxus is a classic finding in which condition? Option A, cardiac tamponade. Option B, pulmonary embolism. Option C, aortic aneurysm. Option D, congestive heart failure. The correct answer is option A, cardiac tamponade. Question 8. A Call's fracture involves the: Option A, proximal humerus. Option B, distal radius. Option C, femoral neck. Option D, tibial plateau. The correct answer is option B, distal radius. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with sudden onset worst headache of my life. The nurse's first priority is: Option A, administer pain medication. Option B, perform a complete neurological assessment. Option C, prepare for lumbar puncture. Option D, obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. Question 10. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C. Irrigate the bladder with normal saline. Option D. Prepare for suprapubic catheter. The correct answer is option B. Perform a retrograde urethrogram before catheter insertion. Question 11. When receiving a verbal or telephone order in an emergency, the nurse should: Option A. Carry out the order immediately without verification. Option B. Write it down and read it back to the provider for verification. Option C. Ask another nurse to take the order. Option D. Refuse to take verbal orders. The correct answer is option B. Write it down and read it back to the provider for verification. Question 12. A patient with sepsis has a lactate level of 4.5 mol/L. This indicates: Option A. Normal cellular metabolism. Option B. Hypoperfusion and anaerobic metabolism. Option C. Kidney failure. Option D. Liver failure. The correct answer is option B. Hypoperfusion and anaerobic metabolism. Question 13. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is: Option A. Application of ice to the bite. Option B. Incising and suctioning the wound. Option C. Application of a tourniquet proximal to the bite. Option D. Administration of antivenom, crotality. The correct answer is option D. Administration of antivenom, crotality. Question 14. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate: Option A. No tetanus prophylaxis needed. Option B. A tetanus immunoglobulin only. Option C. Tdap or TD booster. Option D. A tetanus toxoid and tetanus immunoglobulin. The correct answer is option C. Tdap or TD booster. Question 15. A female patient of childbearing age with abdominal pain should always be evaluated for: Option A. Ovarian cysts. Option B. Pregnancy status. Option C. Endometriosis. Option D. PID. The correct answer is option B. Pregnancy status. Question 16. In a multiple minus casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is: Option A. Green, minor. Option B. Yellow, delayed. Option C. Red, immediate. Option D. Black, deceased/expectant. The correct answer is option C. Red, immediate. Question 17. Which assessment finding is consistent with a flail chest? Option A. A crepitus over the sternum. Option B. Paradoxical chest wall movement. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Paradoxical chest wall movement. Question 18. The purpose of administering surfactant to a patient with ARDS is to: Option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C. Decrease pulmonary capillary permeability. Option D. Increase mucociliary clearance. The correct answer is option B. Reduce alveolar surface tension and prevent atelectasis. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The most common cause of acute renal failure in hospitalized patients is: Option A. Glomerulonephritis. Option B. Acute tubular necrosis. Option C. Renal calculi. Option D. Pyelonephritis. The correct answer is option B. Acute tubular necrosis. Question 20. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute minus onset right leg pain, pallor, and absent pulses. The nurse suspects: Option A. Deep vein thrombosis. Option B. Acute arterial occlusion. Option C. Cellulitis. Option D. Compartment syndrome. The correct answer is option B. Acute arterial occlusion. Question 21. Murphy's sign is used to assess for: Option A. Pancreatitis. Option B. Acute cholecystitis. Option C, diverticulitis. Option D, small bowel obstruction. The correct answer is option B, acute cholecystitis. Question 22. The best method to remove a prosthetic eye in an emergency is option A, using forceps to grasp the prosthetic. Option B, applying suction with a bulb syringe. Option C, using a suction cup designed for prosthesis removal. Option D, sweeping a finger around the edge to break the suction. The correct answer is option C, using a suction cup designed for prosthesis removal. Question 23. Ovarian torsion presents with option A, bilateral lower quadrant pain. Option B, a sudden, severe unilateral lower abdominal pain with nausea. Option C, painless vaginal bleeding. Option D, a fever and purulent discharge. The correct answer is option B, sudden, severe unilateral lower abdominal pain with nausea. Question 24. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is option A, absent breath sounds. Option B, a dullness to percussion on the affected side. Option C, a tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. Question 25. A patient with chronic COPD presents with increased dyspnea. The nurse understands that the primary stimulus to breathe in these patients may be option A, elevated PaCO2. Option B, low PaO2, hypoxic drive. Option C, increased pH. Option D, elevated HCO3. The correct answer is option B, low PaO2, hypoxic drive.